Hello, everyone, and welcome to our question lab. It's nice to see you guys here. I see a lot of familiar names that have been coming and joining us every week, so we're happy to have all of you here. And today we will be covering reproductive. So we'll be doing some questions on the reproductive system. Leading our dissection today is Dr. Paras Vakari, and I'll let Paras introduce himself.
Thank you, Sean. Hi, everyone. My name is Paras. I am currently a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to complete medical school. I've been with RX Coach for a little under a year now, working primarily as an RX coach, working one-on-one with students regarding the USMLE Step 1.
Excellent. And for those of you who don't know what RX Coach is our new one-on-one tutoring program. And I see a lot of our coaching students on the question lab here today. We're glad to have you. One of our other RX coaches is a panelist today. And if you look at your GoToWebinar control panel, you will see a question box. And you're able to ask questions to our panelists. We have two wonderful panelists today, Jeff Downing and Mark Hesslen. Mark, I'll let you introduce yourself.
Hi, everyone. My name is Mark. I'm a third-year medical student at Cooper Medical School of Rowan University in Camden, New Jersey. I've been an RX coach for about 6 months now, working with students for Step 1, and I'm happy to answer all your guys' questions.
Excellent. So once again, you have a question box there. You can ask your questions via that question box. And throughout today's webinar, Dr. Vakari will also be asking you to have some audience responses in there, depending on the questions that we are covering. So that being said, my name is Sean. I've been with RX Coach for about a year and a half, and we have helped a lot of students accomplish their goals, and we'll talk more about that later. As always, we will have a raffle at the end of tonight's question lab, so you must be present to win. So if you're here, make sure you stick around till the end. You may be one of our lucky winners and walk home tonight or walk away from this question lab with a very valuable prize. So stick around and make sure you do that. So now that you've gotten to know us, we want to get to know you. So I'm going to ask you guys a question, and you guys should see it on your screen. You guys would take a second to give us your responses. We will also have these polls up throughout the webinar. We will have our question answer choices in these polls, and you'll be able to select those so we can see what answers you select as we do these questions together. Go ahead and give you guys another second to fill out those responses. Excellent. Well, looks like a lot of you guys have responded. Let's take a look and meet the audience. Looks like we have a majority of you, a big majority of you guys studying for Step 1, and some other folks studying for school exams, COMLEX, and CBSA. And we hope that tonight will be helpful for all of you. Another thing I would like to know is, when do you guys plan on taking your exam? So take a moment to let us know. As you guys know, we do these questions labs every Tuesday at 6 p.m. Eastern Time. Next week, we will be doing our lab on anatomy. So make sure you join us for a nice little refresher on anatomy, because as you guys know, students tend to forget to review that subject, but you are going to have questions on it. So please join us next week as we do anatomy questions. All right, and looks like we have a pretty good split here. Some people taking it here at the end of the year, some in the fall, some next year, and some aren't sure yet, which is just fine. Excellent. So with the introductions aside, let's go ahead and get started. As I said, today we're going to be using the methodology that we use in RX Coach. RX Coach is our new one-on-one tutoring program. If you are interested in working with one of our wonderful RX coaches like Dr. Vakari or Mark, you're welcome to visit us online at rx-coach.com to schedule a free consultation to discuss the program and how it can help you. Being said, let's get into our first question. For those of you joining us for the first time, you'll notice that the answer choices are covered up, and that is by design. I have not put them into the slide. And the reason is we want all of our students to always cover up those answer choices. And that is because we don't want those answer choices to dictate your thought process, to guide your thinking. And we certainly don't want you to see an answer choice that you're unfamiliar with. And that may cause you to panic as you're trying to answer this question. We always recommend that you cover up those answer choices. And once you've covered those up, and I've done that for you here today, we will read the lead-in or the last sentence together. Based on these findings, functioning of which cell type is most likely defective? And after we read that together, we'd like to ask our students, is this a one-step question? Is this a two-step question? Or is it a three-step question? An example of a one-step question could be where they ask you, what is the diagnosis? A two-step question could be where they ask you for a treatment for that diagnosis. And a three-step question is when they ask you, what is the mechanism of action for a treatment for a diagnosis? So those are some examples. So I'll give you guys a second to think about how many steps this question will require you to take. And we'd like to do that so we can have a nice, clean, and organized thought process as we tackle each and every question to maximize all those points on test day. Excellent. So with that being said, we will now read the question together. And in our coaching sessions, our coaches will stop you after every sentence and ask you, hey, what are you thinking? What's your thought process like? What's on your list of differentials? What do you want to highlight? Which clue is important? Why are you not highlighting this? Explain what this means. But we don't have time to do that today with all of you individually. So I will pause briefly after I read each sentence so that you guys can gather your thoughts. All right. A 37-year man comes to the clinic because he and his wife have been unable to conceive a child despite 1 year of unprotected sexual intercourse. The patient admits to having difficulty maintaining an erection and ejaculating. He has a history of cryptorchidism. He currently smokes 1 pack of cigarettes per day and has done so for the last 20 years. Semen analysis shows the following: semen volume, normal. Semen pH, normal. Sperm motility, normal. Sperm count, low. Androgen binding protein, low. Testosterone, low. Follicle stimulating hormone, high. The physician initiates a discussion about manual extraction of mature spermatozoa via testicular biopsy in conjunction with in vitro fertilization as a possible means of conception. Based on these findings, functioning of which cell type is most likely defective? And with that, I will hand it over to Dr. Beccaria.
Thank you, Sean. So I'll go ahead and read out the answer choices. It's important that we start at the bottom and work our way up when we go through the answer choices. This way we don't bias ourselves and come across an answer choice that we think may be correct, but is actually not the correct answer. So starting at the bottom and working our way up ensures that we get through all the answer choices. So I'll go ahead and do just that. Answer choice E, spermatogonia. D, spermatids. C, Sertoli cells. B, Leydig cells. And A, basal lamina. So we'll give everyone a few seconds to gather your thoughts. Sean's going to go ahead and open up the poll. Please go ahead and select the answer that you think is correct, and we will talk about it in just a couple seconds.
Excellent. Thank you, Dr. Beccaria. So we'll give you guys a second to select your answer choice. Remember that it's never a good idea to leave a question blank on exam day. You will not get penalized for guessing. So even if you aren't sure what the answer is here today, don't worry. Take your best guess, and then Dr. Beccaria will go over the correct and incorrect answers with you here shortly. So we'll give you guys a couple seconds to respond. Excellent. Looks like a lot of you guys are responding. And let's see how you guys did. So 45% of you picked Leydig cells and 42% of you picked Sertoli cells. So pretty even there. So let's see what the correct answer is. And the correct answer is C, Sertoli cells. And it looks like about 42% of you got it right. But if you got it wrong, don't. We're here to learn, bridge those knowledge gaps, work on test taking skills so we don't make those mistakes on test day. Dr. Beccaria.
Thank you, Sean. So let's go ahead and talk about this answer choice. So this man, they told us that he has been unable to conceive with his wife despite having unprotected intercourse for 1 full year. So at that point, given that time frame, you should be thinking about an abnormality either with the man or the woman. Now they tell us that this patient had a semen analysis which showed some abnormalities. It showed a low androgen binding protein, low testosterone, and high FSH. So these findings are most likely a result of a defect in Sertoli cells, and we'll talk about why in just a second. Now, androgen binding protein is a glycoprotein synthesized by Sertoli cells. Do you guys know the function of androgen binding protein? On the right side of your screen, there should be a question box. If you want to go ahead and open that up, post in that question box what you think is the function of ABP, or androgen binding protein, and we'll talk about it in just a second.
Excellent. Looks like people are saying for testosterone, ABP binds testosterone, secondary sexual characteristics. Those are some of the responses, Dr. Vicario.
Great, thank you, Sean. Yep, that is correct. The function of androgen binding protein is to maintain an elevated local testosterone levels within the testes, which will allow spermatogenesis to occur. So since the Sertoli cells are not producing sufficient levels of ABP as indicated by the semen analysis, the testosterone levels would then also be low, which is the case in that analysis. Furthermore, the anterior pituitary would respond by synthesizing more FSH in an attempt to increase androgen binding protein. Now, another important clue that they gave us in this question is that they told us that this patient has a history of cryptorchidism. That's a condition where one or both of the testes fail to descend. Now, that would increase the local temperature on the testes and affect Sertoli cells. And as Sean has pulled up in a table that kind of reviews the Sertoli cells, we can see here at the very bottom that Sertoli cells are temperature sensitive. And as also mentioned kind of higher up in that table, Sertoli cells are the ones that secrete androgen binding protein to maintain those local levels of testosterone. Thus, this is why answer choice C, or Sertoli cells, is a correct answer. So let's talk about why the other answer choices are incorrect. E, spermatogonia. These are the most immature spermatogenic cells, and they don't synthesize any hormones or secretory proteins, so that wouldn't lead to any elevated or decreased levels on semen analysis. So an incorrect answer. Answer choice D, spermatids. These are the most mature spermatogenic cells and are derived from spermatogonia, but they also do not secrete any signaling molecules, proteins, and thus would be an incorrect answer. Now, although this patient's sperm count is low, the sperm motility, they told us, is normal. Thus, there's no indication that the spermatids have any dysfunction or are defective because the motility is normal. We talked about how answer choice C is the correct answer, so let's move on to B, or Leydig cells. So these are interstitial cells found outside the seminiferous tubules, and they synthesize androgens such as testosterone, androstenedione, DHEA, and they do this in the presence of LH. So although these cells do produce androgens, they do not produce androgen binding protein, which is abnormal in this question. Now, if the Leydig cells were malfunctioning, androgen binding protein would probably be elevated in an attempt to try to capture and store more testosterone. So answer choice B is a correct answer. Sorry, an incorrect answer choice. And answer choice A, basal lamina. This is a thin layer that separates the inner tubule from the surrounding interstitium. The spermatogonia and Sertoli cells actually sit on top of the basal lamina, but this basal lamina is essentially a tissue that doesn't actually play a direct role in hormones or sperm count. So an incorrect answer choice. So the takeaway point from this question is that it's important to know all the steps of spermatogenesis, the hormones involved, the feedback, both positive and negative feedback, as well as the cells involved, and also the anatomic pathway that the spermatids take during the process of fertilization?
Excellent. Thank you, Dr. Beccaria. And I know this was a challenging question. We had quite a few people that didn't get it correct, but that's okay. We hope that everybody will get it correct on test day. Let's move on now to question number 2. Once again, you guys will see that the answer choices are covered up, and I see that a lot of people just joined us, so I'm going to explain our steps to you again. So the first thing we like to do is cover up those answer choices. I've done that for you already, and the reason is because we don't want these answer choices to dictate your thought process, to guide your thinking, and we don't want you to see an answer choice that you're unfamiliar with, and that may cause you to panic as you read this question. So after we cover up the answer choices, your RX coach will ask you to read the last sentence out loud. So let's do that now together. Which of the following will most likely be affected immediately? Once again, that's which of the following will most likely be affected immediately. I'll give you guys a second to think about whether this is a 1-step question, a 2-step question, or a 3-step question. All right. And once we do that, we will read the question together in our coaching sessions with one of our coaches like Dr. Beccaria or Mark. They will ask you to stop after every sentence. They'll ask you, what do you want to highlight? What clues are important? What's a distractor? What are you thinking? What's on your list of differentials? And by doing that, we're able to see your thought process and work with you on an individual basis to focus our efforts on making you the best test taker possible. Because everybody's different. Everybody learns differently and thinks differently. We want to give you that one-on-one attention to maximize your potential on test day. So with that being said, let's read this question together. A healthy 21-year-old woman with no history of significant illness comes to the physician requesting combination oral contraceptives. She is sexually active and always uses condoms as contraception. No abnormalities are noted on physical examination. The result of a urine test for beta human chorionic gonadotropin is negative. She is prescribed a combination oral contraceptive. Which of the following will most likely be affected immediately? Dr. Beccaria.
Thank you, Sean. So we will go ahead and read those answer choices. And once again, we will start at the bottom and work our way up. Answer choice E, ovulation. D, mid-cycle surge of luteinizing hormone, or LH. C, fertilization of ovum. B, change in estrogen concentration during follicular phase. And lastly, A, blastocyst implantation. So we'll give everyone a couple seconds to gather your thoughts. Sean's going to go ahead and open up that poll. Please take a second to go ahead and select the answer choice you think is correct, and we will talk about it in just a few seconds.
And Dr. Beccaria, I see a lot of people saying it's a 1-step question, or some people saying it's a 2-step question. So guys, Dr. Beccaria was going to go over that with you when he explains those answer choices to make sure that we're all on the same page with our thought process. I'll give you guys a couple of seconds to gather your thoughts and select an answer. Once again, no penalties for guessing. So if you're not sure what the answer is, take your best guess. And take a look at the clues in the question to make sure you're answering the correct question. We'll give you guys a few more seconds. Looks like about half of you have voted. We'll give you the other half a couple more seconds. Excellent. Let's see what you guys did. Looks like 45% of you picked answer choice B, change in estrogen concentration during follicular phase, when 24% of you picked D, mid-cycle surge of luteinizing hormone, and 23% of you picked E, ovulation. Let's see what the correct answer is. The correct answer is B, change in estrogen concentration during follicular phase, and it looks like 45% of you guys got that right, so well done. And I will turn it back over to Dr. Beccaria.
Thank you, Sean. So Sean actually has pulled up there the different phases of the menstrual cycle. So this is a pretty high yield topic and important to understand this question. So let's take just a minute or two to review what's going on here. okay? So now normally the normal menstrual cycle consists of a follicular phase and a luteal phase, and you can see those both there. So the follicular phase begins after the onset of menstruation, and that is characterized by FSH stimulated growth of one or more dominant follicles, okay? Now, do you know what it is that these follicles or dominant follicle will release? Go ahead and open up that question box again. Post in that question box what you think that follicle is going to release.
Well, so we have a couple people saying estrogen. Not too many responses yet, but we've got a few saying estrogen. Yeah. So Dr. Vicaria.
Great, thank you, Sean. Yep, that is the correct answer. They release estrogen, and that's important in this question. So estrogen causes the uterus, the endometrium to thicken, and then the follicular phase. Now, for most of this follicular phase, estrogen will work to negatively inhibit via negative feedback FSH and H production. However, late in that follicular phase, you see there, estrogen levels actually have a positive feedback effect on LH, and you can see that rise in LH concentration on that graph. This is called the L surge. So once again, the high estrogen concentration in the later parts of the follicular phase actually will lead to positive feedback and start of the luteal phase and subsequent ovulation, as you can see with that arrow and the red text of ovulation. Now that oocyte of that dominant follicle is released a little bit after that LH surge. The remnant follicle, as you can see there, becomes the corpus luteum, and that releases progesterone. Progesterone causes the endometrium to stop thickening and causes glands to become more secretory or secretory endometrium. The corpus luteum slowly starts to resolve later in that luteal phase, and then also occurs when LH decreases. And that leads to sloughing of the endometrium and the beginning of menses, and that cycle repeats itself. So now going back to this question, we have a 21-year-old healthy woman who is requesting combination oral contraceptives. So that consists of both progesterone and estrogen. So how do OCPs work? So progesterone provides negative feedback to decrease the release of gonadotropin releasing hormone from the hypothalamus, which then decreases the secretion of FSH and LH. Once again, the progesterone provides negative feedback to decrease the release of GnRH, or gonadotropin releasing hormone, which then decreases the secretion of FSH and LH. So the immediate effect of decreased FSH is to inhibit the development of those follicles we were talking about, which secrete estrogen, and thus you will immediately, the first thing that would happen is you would not have that increase in estrogen concentration during that follicular phase. Now it's important, like Sean said, is this question is asking which of the following is most likely to be affected immediately. That's the most important phrase or word in that question. Without that end follicular peak in estrogen, you won't have positive feedback on LH, and you won't have that LH surge. Without the LH surge, ovulation can occur, and thus this is how OCP suppress ovulation. But as mentioned, the most immediate thing that happens is you don't have that change in estrogen concentration, which then can lead to the following downstream things not happening. But the first thing, the immediate thing, is answer choice B. So let's talk about why the other answer choices are incorrect. Answer choice E, ovulation. So although you will have downstream ovulation inhibition, ovulation is not the process that is most immediately and directly affected by the decreased FSH concentration. The immediate effect, like we said, is decreased follicular phase estrogen concentration, which then eventually prevents the LH surge and subsequent ovulation, but is not the immediate thing affected. Answer choice D, the mid-cycle surge of LH. Once again, that decreased concentration of FSH will lead to will prevent the LH surge happening downstream, but that is not the immediate thing that is affected first. It only happens because of a decreased estrogen concentration, which is why you do not get that surge of LH. So thus the first thing happening before that is a change in estrogen concentration. Answer choice C, fertilization of ovum. Now OCPs, like we mentioned, decrease FSH concentration, which prevents fertilization by inhibiting ovulation. Unlike OCPs, there are other things that actually work to inhibit fertilization, such as intrauterine devices. These work primarily by directly inhibiting fertilization. For example, progesterone released from hormonal IUDs can thicken the cervical mucus, and that prevents sperm from reaching the fallopian tube. Copper IUDs, they contain copper ions that act as a spermicide. That prevents sperm from fertilizing the ovum. But in this question, we're talking about combination OCPs and not those other contraceptive devices. Lastly, answer choice A, blastocyst implantation. So during that luteal phase of the menstrual cycle, progesterone works to prepare the endometrium for blastocyst implantation. However, that's a very downstream effect again, and not the intended effect of oral contraceptives, specifically combination ones. So that is also an incorrect answer. So the takeaway point here is that menstrual cycle, although there's a lot of things going on, it's very high yield. It can be confusing at times. So the more time you spend on it to really understand what's going on will help you be able to answer questions such as this.
Excellent. Thank you, Dr. Vicaria. Let's move on to our next question. But before we do that, I want to tell you a little bit about RX Coach. I know I mentioned it here before, and as you know, Dr. Vicaria and Mark, our panelists, they're both RX coaches. Our new tutoring program, RX Coach, starts off with a 160 question assessment. We use that assessment to help gauge your strengths and weaknesses, and then after we analyze that, we help come up with a personalized study plan. We use a one-on-one approach to bridge those knowledge gaps and work on test taking skills, because as you know, everybody in every class is different. Every single person that you meet in your class thinks differently, has different strengths and weaknesses, and applies their knowledge in different ways. So we work with you one-on-one to maximize your potential. And we call them coaches because coaches do coach you, and they're USMLE experts. They're trained, they're highly qualified, they're selected carefully, and they're trained thoroughly to help give you that guidance. And they've had so much success with our students. And if you want to be a part of RX Coach, if you want to be one of our success stories, please visit us online at rx-coach.com to schedule a free consultation to discuss the coaching program and how it can benefit you. All of our packages do include access to RX 360 and access to RX Bricks. Okay. Now, Dr. Vicaria earlier was mentioning, make sure that you know about the cycle, the menstrual cycle, the follicular phase, and luteal phase. One of the things you guys can do is look at RX Bricks and look at our Express videos to learn that material and make sure you have it down. And I'll go over and show you an RX Bricks here at the end of today's question. With that being said, let's move on to question number 3. Once again, as you guys can see, the answer choices are covered up, and we will start by reading the last sentence together. Which of the following is the most likely cause of this patient's condition? And now we will read the question together. A 27-year-old man comes to the clinic because of a 2-day history of 10 bumps in his groin. He is sexually active and reports having unprotected intercourse with men and women. He denies any dysuria, discharge, fevers, joint pains, myalgias, rash, or recent illness. He does, however, report that he noticed a small painless ulcer on his penis that resolved on its own. The ulcer started at approximately the time he was in the Caribbean for vacation 1 month ago. His temperature is 37.4 degrees Celsius or 99.3 Fahrenheit. Pulse is 88, respirations are 16, and blood pressure is 122/70. There is bilateral tender inguinal lymphadenopathy with 2 centimeter overlying ulcerations. A rapid plasma reagent or RPR test is negative. Which of the following is the most likely cause of this patient's condition? Dr. Viccaria.
Thank you, Sean. So let's take a quick second to talk about how many steps this could be. So 1, we may need to figure out what exactly is going on with this question. What is the disease or diagnosis? And 2, what is the pathogen that causes that? So this is likely a 2-step question. So let's take a look at these answer choices. And once again, we will start at the bottom and work our way up. Answer choice E, Klebsiella granulomatis. D, human papillomavirus. C, herpes simplex. B, Haemophilus ducreyi. And A, chlamydia trachomatis. So once again, we'll give everyone a couple seconds to gather your thoughts. Sean's going to go ahead and open up that answer poll. Please select the answer choice that you think is correct, and we'll talk about it in just a couple seconds.
Excellent. We'll give you guys a couple minutes here, or a couple seconds rather, to select an answer choice. I see a pretty even split so far. So like I said, no penalty for guessing. So please do take your best shot, and then we will review the correct and incorrect answers together and see what the answer is. Give you guys a couple more seconds to submit your responses. Looks like we've got some got 2 close to first place here. Almost a tie. All right, let's take a look. Looks like 33% of you picked chlamydia and 30% of you picked Haemophilus. So let's see what the correct answer is. And the correct answer is A, chlamydia, and 33% of you guys got that right. So if you didn't get it right, don't worry. Dr. Viccaria is going to teach us all about it right now. Dr. Viccaria.
Thank you, Sean. So this is a 27-year-old male who told us that he has a history of Caribbean travel, unprotected intercourse, and a recent self-resolving painless genital ulcer. That's important, painless genital ulcer. Now, he is now presenting with a 2-day history of tender ulcerated lymphadenopathy. Once again, tender ulcerated lymphadenopathy. So, can you guys name the diagnosis of what this patient has? I know we said this is a 2-step question, so first let's try to figure out what that diagnosis is. Go ahead and post in the question box what you think is the diagnosis, the name of the disease.
Excellent. Dr. Viccaria.
Thank you, Sean. So this is the most likely diagnosis here is lymphogranuloma venereum. And this is caused by chlamydia trachomatis serotypes L1 to L3. Now, lymphogranuloma venereum commonly occurs in those tropical areas, which is why they were probably telling us that he was in the Caribbean. So the first stage of an infection is a painless ulcer that heals spontaneously, which is what they told us. The secondary stage involves buboes, which are ulcerated lymph nodes that appear in the inguinal region, which is what they told us with this patient. Now, late stage lymphogranuloma venereum can involve strictures, fibrosis, sinus tracts, but at this point, we're kind of more so at that secondary stage. So let's talk about why the other answer choices are incorrect. Answer choice E, Klebsiella granulomatis. Now this is referring to granuloma inguinale. And this can also initially present as a painless genital ulcer. However, there is no adenopathy associated with this disease, and therefore it would not likely be the cause for this patient who does have tender ulcerated lymphadenopathy. So likely an incorrect answer. D, human papillomavirus. These cause genital warts, which are a risk factor for cervical cancer, anal cancer, but are not the cause of genital ulceration. So an incorrect answer as well. C, herpes simplex. This normally causes genital herpes, which would also be unlikely because it usually starts as multiple painful vesicles, not a small painless ulcer. So also incorrect. And lastly, answer choice B, which was also a highly selected answer choice. So Haemophilus ducreyi is getting at chancroid. Now, this can present with bilateral inguinal lymphadenopathy as well. But most importantly, the initial lesion is painful. They told us in this patient that it was painless. So a lot of subtle clues in this question. So the takeaway point from this question is that STDs and infections are obviously very high yield. And it's important to know those subtle clues because that's really a lot of times all you're going to get, and that'll help you differentiate the diseases. And then lastly, it's also important to know that the treatments for all of these various sexually transmitted diseases as well.
Excellent. Thank you, Dr. Beccaria. Let's move on now to our last question of the evening, and make sure that you guys stick around till the end because we do have a raffle, and 2 of you will win access to our wonderful resources, and that'll be free for you. So make sure you stick around because you must be present to win. All right. Last question. Here we go. Once again, answer choices are covered up, and we will read the lead-in together. Which of the following is the mechanism of action of a medication used to treat this condition? I'll give you guys a second to think about how many steps this question will require, and then we will read the question together. All right, looks like we're getting some responses, so let's read the question. A 74-year-old man comes to the physician because of increased urinary frequency along with difficulty starting and stopping urination. His wife states that he wakes her up multiple times throughout the night when he hurries to the bathroom, yet he is unable to urinate. Which of the following is the mechanism of action of a medication used to treat this condition? Dr. Beccaria.
Thank you, Sean. So a few steps here. Let's try to figure out how many steps this question may be. So 1, I think we need to figure out what this condition is. 2, I think then we need to figure out what's a medication that can treat that disease. And then 3, what is the mechanism of action of that medication? So probably a 3-step question here. So let's go ahead with those answer choices. Answer choice E, inhibition of testosterone's negative feedback on gonadotropin secretion. D, inhibition of cytochrome P450 enzymes. C, inhibition of an enzyme that catalyzes a reduction reaction on steroid molecules. And B, gonadotropin releasing hormone analog. And A, antagonism of muscarinic receptors. So once again, we'll give everyone a couple seconds to gather your thoughts. Sean's going to go ahead and open up that poll. Please select the answer choice you think is correct, and we'll talk about it in just a couple seconds.
And as you guys can see, the answer choice for E and C are cut off a little bit because we couldn't fit it all in there, so I'll read those to you. Answer choice E is inhibition of testosterone's negative feedback on gonadotropin secretion. And answer choice C is inhibition of an enzyme that catalyzes a reduction reaction on steroid molecules. I'll give you guys a couple seconds here to submit your responses. Excellent, looks like we have a lot submitted. We'll give you guys a couple more seconds to answer our last question of the evening, and then I will show you one of our newer resources, and then we'll do a raffle So make sure you stick around because you must be present to win. And if you guys like the approach we took today, the way we dissected questions, the way we explained what was right, what was wrong, imagine how much better it would be if it was just one-on-one. If you want to take advantage of that service to bridge those knowledge gaps, work on those test taking skills, get a personalized study plan, and have a coach that can hold your hand throughout your journey on your path to 250, please go to rx-coach.com to schedule a free consultation to discuss our tutoring program. If you want some generalized advice or want to look at our blog or take a look at our free study planner, please visit us at firstateam.com. And it looks like 40% of you guys picked A, antagonism of muscarinic receptors, and 37% of you picked answer choice C, which was inhibition of an enzyme that catalyzes a reduction reaction on steroid molecules. Let's see what the correct answer is. The correct answer is C, inhibition of an enzyme that catalyzes a reduction reaction on steroid molecules. And 37% of you guys got that right. Dr. Beccaria.
Thank you, Sean. So this patient is presenting with classic symptoms of benign prostatic hyperplasia, or BPH. For example, they told us that he has difficulty starting a stream, difficulty stopping urination, and he has difficulty even urinating as well. On top of that, the other symptom was increased urinary frequency. So that is the likely diagnosis, and we talked about how this could be a three-step question. Can you guys name some drugs that could be used to treat BPH? Go ahead and open up that question box one more time. Post in there some drugs that you know that can be used to treat BPH, and we'll talk about it in just a second.
Excellent. So a lot of people are saying finasteride. We've got prazosin, tamsulosin, Osins. Dr. Beccaria.
Great, thank you, Sean. Yes, absolutely. Those are all drugs that can be used to treat BPH. Now, specifically, finasteride is one that can be used to treat BPH, which is what a lot of people have responded with. And that acts by inhibiting the conversion of testosterone to dihydrotestosterone, or DHT. Now, testosterone, remember, is a steroid molecule, and the enzyme that converts that is 5-alpha reductase. So finasteride is inhibiting the enzyme 5-alpha reductase that catalyzes the reduction of testosterone, which is a steroid molecule, to DHT, or dihydrotestosterone. So DHT is the culprit behind BPH, and inhibiting the formation of DHT leads to a reduction in the size of prostate and then a relief of symptoms. So let's talk about the other answer choices and why they are incorrect and what drugs they may have been getting at with those answer choices. So E, inhibition of testosterone's negative feedback on gonadotropin secretion. This is getting at flutamide, which acts by that mechanism listed in the answer choice E. It is used primarily in conjunction with the gonadotropin releasing hormone, such as leuprolide, for the treatment of metastatic prostate cancer. It is not used for the treatment of BPH. Answer choice D, inhibition of cytochrome P450 enzymes. This is a tough one, but this is probably getting at ketoconazole. Although this is an antifungal agent, it also has anti-androgenic properties. However, it is used more so for polycystic ovarian syndrome, or PCOS, and is not used for the treatment of BPH. We talked about how C is the correct answer choice, so let's move on to B, gonadotropin releasing hormone analog. This is getting at, as mentioned earlier, leuprolide. It is a gonadotropin releasing hormone analog that binds to the GnRH receptor in the pituitary. It is used for, as mentioned earlier as well, metastatic carcinoma of the prostate, and also can be used in vitro fertilization, but is not used for the treatment of BPH. And lastly, answer choice A, which was a highly selected answer choice as well, antagonism of muscarinic receptors. This is getting at agents such as oxybutynin. And these are used to treat certain types of incontinence called urgency incontinence. This is characterized by urinary leakage and the need to void immediately. This patient, however, is presenting more so with symptoms of overflow incontinence from BPH. They told us specifically he cannot start and has difficulty starting and stopping his stream, and even has difficulty actually urinating as well. So not so much urinary leakage or urgency incontinence. So that's why answer choice A is also an incorrect answer choice, and answer choice C is a correct answer choice in this question.
Excellent. Thank you, Dr. Vicaria. And that, with that being said, we just talked about BPH, which is a benign condition, but if you want to review reproductive, one of the hot topics is prostate cancer, and we have a new resource called RX Bricks, and I want to show you how RX Bricks work. So each brick starts off with a list of learning objectives that we hope you will learn and master, and we want you to master with each brick. Then you can scroll down to start learning about the topic, which in this case is prostate cancer. So it'll explain everything to you. You have visuals here from first aid as they come up. You also have some practice flashcards here. Mnemonics are also embedded here within the brick. So you can review this topic of prostate cancer. And once you get to the end of this brick, you will be able to really see a summary of everything you should have learned, and then practice with some practice questions. And if you want to go deeper and you want to learn more about any topic that you're learning about with a brick, you can go deeper in first aid. It'll tell you exactly where to find that material. You can go deeper and study it with flashbacks. It tells you how many cards and how many minutes. It tells you how many express videos we have and how long it'll take you to watch those. It even tells you how many practice questions we had in COMLEX and how long it'll take you to do those questions. And you can click on this and go directly to that resource if you have access to RX Bricks. And of course, you'll be able to review those learning objectives and mark off your confidence on those learning objectives. So be sure to take a look at RX Bricks